Welcome to the third video in the Training Toolkit series. This video covers the protocols and procedures for hearing screenings. There are two types of screening methods, OAE or otoacoustic emissions testing, and AABR or automated auditory brainstem response testing. Before discussing each of these tests in more detail, let's compare and contrast the two methods. OAE testing is faster than performing an AABR. However, it's not sensitive to all types of hearing loss. AABR testing requires more time to complete, but it's sensitive to all types of hearing loss. AABR is also the required screening method when an infant has been in the NICU for longer than 5 days. One way that each of these methods are similar is that both OAE and AABR screenings can be impacted by middle ear issues such as fluid. Now we will spend some time learning about each method in more detail. AABR, or Automated Auditory Brainstem Response, tests the response of the auditory nerve and brainstem to sound. This screening procedure can be used to predict the infant's hearing sensitivity. I want to highlight two important details regarding AABR screening. AABR is the only acceptable measure for screening infants in the NICU. Also, if an infant's initial screening was performed via AABR and the infant didn't pass the screening, that infant cannot be rescreened with an OAE. The infant must be rescreened with another AABR. OAEs, or otoacoustic emissions, are sounds that originate in the cochlea, specifically from the outer hair cells, and travel back through the middle and outer ear. Sometimes the sounds are spontaneous, other times they're evoked by playing sounds into the ear and measuring the echo that comes back. OAEs are measured with a microphone that is inserted into the ear canal. This screening method doesn't test the infant's actual hearing sensitivity. Reduced or absent OAEs might indicate the presence of a hearing loss, but additional tests must be done to confirm these findings. Before performing either an OAE or AABR test, be sure to wash your hands and follow your hospital's infection control policy for cleaning the equipment. Inform the infant's parents or guardians about the hearing screening. If present, parents and/or guardians will need to remain quiet during the test. Review the hospital's policy regarding the need for a signed consent form. Perform the screening within the first 24 hours of the child's life or sooner if the child will have an early discharge. If performing an AABR, the baby will need to be asleep. Also make sure to perform the screening in a quiet area. To complete an AABR screening, first swaddle the baby. Place the baby on his or her side or back. Prep the skin for electrodes. Scrub the baby's skin with prep paste and a cotton swab or pad, and wipe the skin of excess paste. Next, apply the electrodes. The next slide will describe where to place the electrodes. Use paper tape if you're having a difficult time getting the electrodes to adhere to the baby's skin. Put the inserts into the baby's ears. The blue insert goes into the left ear, and the red insert goes into the right ear. Also, on the next slide will be a visual demonstration. Here are a series of photos showing how the electrodes and inserts should be placed. The white electrode goes on the high forehead, and the black electrode goes on the low forehead. Make sure these two electrodes are not too close to each other. The red electrode goes on the right mastoid, and the blue electrode goes on the left mastoid. When placing the electrodes, make sure to press around the edges, not the centers. Finally, the red insert goes into the right ear, and the blue insert goes into the left ear. If the baby does not pass the screening on the first try, verify that the electrodes are connected properly. Also verify that the inserts are emitting a sound. You can also repeat the screening, but make sure to limit the screening session to only 2 attempts per ear. If the artifact is too high, wait for the baby to fall asleep, check for impedance values and scrub and reapply electrodes if needed, and eliminate electrical interference in the room by unplugging other equipment if the AABR machine plugs into an outlet. If needing to repeat the AABR, screen both ears before discharge if the baby referred on the initial screen, or if a change in the baby's medical status necessitates an additional screen. When screening with AABR in the NICU, it is acceptable to rescreen once before discharge. If the baby refers the rescreen on one or both ears, schedule an appointment for an outpatient diagnostic ABR with an audiologist. A diagnostic ABR can also be performed before discharge if your facility has the capability to do so. To perform an OAE screening, first swaddle the baby. Place the baby on his or her side or back. Then select a clean probe tip and insert the tip on the probe. Pull down and back on baby's ear to open the ear canal. Insert the probe deeply into the ear canal. Next, remove your hand from the probe and start the screen when the baby is quiet. Use a clean probe tip for each baby. If the baby does not pass on the first try, then you should remove the probe and check for debris. Clean the tip or replace it if needed. You can also massage the ear. Rub in front of the ear in a circular motion. Move the ear forward with one hand while gently tugging upward and outward on the back of the baby's ear with the other hand. Then reinsert the probe and rescreen. Again, please make sure to limit to only 2 attempts per ear. If the baby did not pass on the initial screening and it's necessary to repeat the hearing screening, rescreen both ears before discharge, but again, remember to limit the screening to only 2 attempts per ear. We have finished reviewing the protocols and procedures for performing hearing screenings with both OAE and AABR testing. Referring back to the bundled approach represented by the acronym TSST EARS, your next step would be to discuss results with parents. Please advance to the 4th video in this training series to learn the scripts you can use when talking with parents.